Excellent. So thank you all for joining us, everybody on Facebook and YouTube. It's lovely to see you again today, and also everybody who is watching this recording again later. We are talking about newborn skin. So all of those things that you look at your baby and you go, oh, hang on a sec, is that okay or is that not okay? So Deb has put together some fantastic pictures to show you all sorts of how these things that she's talking about looks. So we'll get those up in a minute. But what we would love you to do before we go any further, just to make sure, A, that all of the technology is working as it should be. And also because we want to hear from you as well, if you could give us a thumbs up or a wave or a comment there, just to let us know, even where you're watching from, because we really do, some of the places where we get people watching from is absolutely fantastic, the reach that we've got, and we love that. So talking about newborn skin today, I should probably introduce myself for all of the new people who are joining us. My name is Sarah Hunstead. I'm a paediatric nurse, a mum of 2, and founder of CPR Kids. And I am joined by the fabulous Dr. Deb Levy, who is a consultant paediatrician. Well, I always put different words in front of that. Holistic consultant paediatrician, a specialist paediatrician. So basically, she's got a whole lot of amazing qualifications and is a really good doctor. How does that sound?
Oh, so sweet. Thank you, Sarah. And for those of you on Instagram, don't worry, I will actually follow up this live with a whole lot of photographs. So everything that we're going to be talking about today, you'll have access to as well. So yes, thank you, Sarah. Yes, I'm a pediatrician and a mum to 2 girls and 2 dogs. So that's my happy family. Both of which are actually sleeping on my couch at the moment. My puppy was de-sexed yesterday, so she's feeling a little sorry for herself. So excuse me if the dogs start participating at any point, but I just needed to keep them a little bit close to me today.
Excellent. Okay. No, bless them. I've got my puppy dog just on the other side of this door here, and I can hear her throwing tennis balls at the door. So if you can hear a thud every now and again, it is just literally the dog throwing tennis balls at the door to try and get in. Now, I do have one little issue here. I thought to myself, I'm going to quickly update Chrome. Because it runs much faster if I update Chrome. So let's do that. So I did that just prior to us starting. And of course now, it now says that because it's all reset, that the software that we're using to broadcast to you doesn't have permission to share screen, which means we have no pictures right now. So Deb, what I might get you to do is I will just try and sort this out just for a second. And I'll get you to start talking about newborn skin, if that's okay.
Sure. Obviously, ideally to have some photographs. I mean, Sarah, maybe you can see if I can share, but I mean, it might, because I've got different.
I think I can fix it pretty quick, actually.
No problem. Okay.
Yeah.
So let's start right at the very beginning then, in terms of, well, what do you expect when your baby's actually born? And firstly, it kind of depends on whether they are early at times, so on term, or post date, so post term. And, typically those babies who have come a little bit early have got extra vernix on them. And that's that white, it's that greasy, very sticky substance that sits on their skin. And term babies will also have that as well. And that is a beautiful, beautiful, I guess, what do I want to call it, material that I'm never in a rush to wash off. I usually like to keep it on babies for a few days just to help their skin and to help keep that moisture in. The babies who are post dates often don't have a lot of vernix and can look like they've been in the bath for a long time. In other words, their skin can be a little bit wrinkly. They can actually even sometimes be peeling a little bit on their fingers and toes, but often we'll just see that really that drenched kind of waterlogged look. These are all changes that will all rectify within themselves, so it's nothing to be worried about. The other thing to mention is that sometimes babies can be born with skin that's become a little bit discolored if they've pooped inside you. So if they've passed meconium, that first dark green, black, tarry poo, and they've been sitting in it for a little while, their skin can actually be a little bit discolored from that, but don't worry, with a simple wash that comes straight off. So that is I guess that's what I just wanted to start with in terms of, well, what do you expect when babies pop out? And then the next big question mark is around different birthmarks and congenital discoloration. So I mean, as you can imagine, when it comes to skin, comes to dermatology, it's this huge plethora of possibilities. And I really just want to look at the most common things. So the things I'm going to talk about today are, and I'll use the technical words and I'll explain to you exactly what they are as we go. It's milia, toxic erythema of the newborn, seborrheic dermatitis, Mongolian spots, hemangiomas, as well as neonatal and infantile acne. So we've got a whole lot of stuff to cover. I'm going to try and give as much information as possible, and really just give you that go-to with your newborn skin. Sarah, how are we doing with the sharing? Because I'd like to...
No good, unfortunately. The reason is that it says that I have to completely restart Chrome to do this, and that will cut off our broadcast. So that wouldn't be any good. So, Deb, you should have permission now. If you are able to share your screen, that will work. Yeah. Oh, I love it when you see, I'm a nurse. I'm not an IT expert here. I like to think that I'm reasonably good at this stuff, but sometimes, honestly, it just comes back and bites me in the bum, especially when my 13-year-old has started now to come. If I'm doing something on my phone, Mum, you don't do it like that. I'm like, oh, come on, please. But anyway, the 13-year-old always knows better. So we can go ahead and share screen now, Deb.
So hopefully you guys who are following this on Facebook can see it. Again, Instagram, do not worry. I will post these with the little tab of exactly what the diagnosis is. Maybe we'll do it as a little bit of a quiz afterwards.
Perfect.
Okay, so let's just start. I just want to let you know also that I've got a great resource for you guys. And this is about all things newborn, not specifically about skin. If you just go to my website, drdeblevy.com/newborns, you'll be able to download that.
Great resource.
Yeah, it is actually. I think it's pretty good anyway. So in no particular order, let's just start with toxic erythema of the newborn. And I think the important thing to first say is that this is not at all toxic. It's a horrible name because it's very awful. It's very, very misleading. Oopsie daisy, sorry, I went back. That's my mistake. And as you can see here, I've said that it's totally benign. Around about 50% of children will get it, and they usually get it within the first few weeks of life. We don't really know what causes it. We think it could be from the change in hormones that baby's exposed to from inside your belly to outside, but we're not totally certain. And what does it look like? It literally looks like little pimples, little bumps, usually quite yellow, with redness around it, so surrounding erythema. Erythema is a fancy word for red, by the way. It's often on the face and then also on the trunk. It doesn't really affect the hands or the soles of the feet, and it really doesn't bother your baby. It bothers parents because it interferes with photographs and it doesn't look so pretty. But it is totally benign, and it will go away without any consequences at all. Okay. Of course, I've also got a phone call coming through. It's all happening today. Oops, what happened? Did I just lose that?
No, you're all still good here, Deb.
Sorry, I now just lost my my
you know what
share.
You know what I quite like? I quite like the fact that we are much better clinicians than what we are at IT. And you know what?
I don't think we do too badly, actually.
No, we don't do too badly, but I do think we're definitely better at the medical stuff, though, which is what you'd hope. That's why you're here. You want us to be, better at that than the IT stuff, to be completely
honest. Exactly. And now, for some reason, my screen share has gone off on my side, which means I can't change the... Give me 1 second. Sorry, guys.
No, that's all right.
I appreciate your patience between Sarah's technical stuff and mine. And now I've got some bug flying into my face. It's all just happening today. I'm going to have to stop and restart, I think.
No problem. We can do that. That's very easy. Yeah. See, this is, we're problem solving on the go here. Like, honestly, it just goes to show we're mums. Like, no offense to, I mean, to anybody else who, I'm just doing a bit of a generalization here, but we can multitask really, really well.
Sometimes. Okay, so we've kind of covered toxic erythema of the newborn. First few weeks of life, totally benign, looks like pimples and is annoying for us as parents, doesn't bother your child. The next little thing that babies will often get, and is again totally benign, doesn't bother them, are those little white spots that typically happen around their nose, and that's called milia. It's because of blocked pores. Again, around about 50% of babies get it. It can be inside the mouth, which is quite interesting, and it resolves on its own within a few weeks.
Right. I've never seen it inside the mouth. There we go. That's very interesting.
You can get other things inside the mouth too, called Pearl Epstein spots. I think that's the right word. I forget sometimes the when it's given people's names, I've forgotten what that's called. Okay, so let's move on to the next one. And this is a birthmark. So this is your baby will be born with, and you may have heard of it labeled as a stork bite or angel kisses. And I think they're really sweet names. But essentially what this is, it's those flat, pale red, pink lesions, birthmarks that either happen here around the eyes, or between the eyes, or at the back of the neck. And those are the two classic places. It's called also salmon patch or nevus simplex. And really it's I don't want to use the word malformation, but it's a malformation of this very, very small blood vessels in that area. Around about 40% of children get it. It is totally benign. So even though I say that the blood vessels are slightly abnormal in that area, it's nothing to worry about. It doesn't grow. It doesn't cause any problems at all. It can flare up at times. In other words, it can suddenly get bright red if your baby's crying, screaming, straining to make it through. That's when classically it'll kind of like, oh my goodness, what's happening with that? But you'll see when your baby calms down again, it'll go back to that much paler color. And
I'm laughing at that because my youngest had them had across her eye, and we knew when she was pooing because it would go bright red.
There you go. Exactly. And usually they resolve. So especially the ones on the face, I find are more likely to go away. Sometimes, they last on the back of the neck a bit longer, but it doesn't matter. It's usually in the hairline. And they usually resolve by about a year of age. The next one, a lot of us have experienced this with our children, and that's cradle cap, also known as seborrheic dermatitis. Right. Hands up for everyone who's had a child with this.
Yes, two of them.
Yeah, exactly. And it can be really, really quite bad. It can be very mild, and it usually affects the skull, so the the areas with hair, as well as the eyebrows are the other place that it affects. And, typically it's this crusting, can be a yellowish color, can also affect skin folds when it's not crusting, but it just looks red and splotchy. And that can be a little bit difficult to distinguish. And that's, obviously with all of these things, by the way, always, it's not up to you really to diagnose them. I'm just merely educating you. Yep. And the thing with cradle cap is even the very severe ones, and they can be really severe, and I'll post a few photos of that. It doesn't bother your child. It really doesn't bug them. Again, it bugs us because sometimes it doesn't look so pretty. But, it's often one of those things where I say to families, well, let's just leave it and we won't do anything and it'll all just go away on its own. If, however, it's very severe and can really get quite thick caking, then sometimes we'll use creams to try and help break that down and soften it. There are a lot of, not old wives' tales, but I guess traditional ways to get it off, like olive oil, brushing it off, toothbrushes I've heard. I'm sure you've got a few stories, Sarah, picking it off. I think my experience is that it often just comes straight back.
Yeah.
And when you're rubbing it off, sometimes you're bringing out the hair follicles as well, which is okay. It doesn't mean they're going to be bald forever because baby's hair does fall out and then regrow. But it's just a case of, well, if it's not really bothering them, let's just let it be. What are your views on that, Sarah?
Oh, yeah, no, I agree. I remember being told one of my children had a very mild dose of it. One had it just caked on her. It was just how it was. And I can remember being stopped in the street and people giving me all of this different advice. I remember one woman said to pour olive oil on her head and use a credit card and scrape the credit card across her head. And I was just like, I think she'd be traumatized if I did that, and certainly no, we just left it as it was, and it did eventually go away, because we did
100%.
find if some did lift off where it was and it was coming out through the hair and we did it, it'd just be replaced so quickly again anyway.
Exactly.
They're really, yeah.
And the thing I always go is, well, around about 50% of babies get it, but if you look around, no adults have it, so it does all go away.
Yep, absolutely.
Now onto the dreaded eczema that everyone worries about. And it can actually start as seborrheic dermatitis, this cradle cap, which is why I say, if you're worried about a rash, or if you've got any queries about what your child's rash is, chat with your doctor. The important thing with eczema in the diagnosis of it is we kind of look at a few factors. We look at the actual rash itself, and then we also look at family history. And that's very, very important, because there's an incredibly strong link with family. And there's a group of conditions called atopic conditions, and that includes eczema, asthma, hay fever, also known as allergic rhinitis, and food allergies. So if anyone in the family has got any of those four, your child is at higher risk of developing one of those. And we could talk about actually eczema probably for one whole life, because I think it's quite an interesting topic in terms of what you can do, when you're pregnant, even to see if you can try and prevent your baby being born with it. But, if your baby does have it, it really is about thorough care from the beginning. And by that, I mean using the right skincare products on your child to try and help that, that condition from not progressing, to try and curb it. So, where does it happen on young babies? So again, we're talking about newborn baby conditions. Very few newborns will be born with the eczema within the first weeks. It usually starts after that. But it typically will affect their cheeks and their face when they start off, and maybe their neck as well. The older children will get it in their elbows, behind their knees, but for younger children, it starts on their face.
Okay.
And that's really irritable for a child. And you'll see they're trying to whack it. They're trying to rub their face. And they even, when they're moving their head, they're rubbing it on the sheet. I know I saw a family the other day who said, their baby used to roll over onto their tummy and rub their face furiously on their bassinet sheet, which I've just asked that it's so heartbreaking, because that child is obviously experiencing quite a lot of itch and discomfort.
Yeah, that's awful.
Yeah, so it is important to know what it is, and how to step in early with treatment to try and prevent it getting worse.
Yeah, definitely.
The next thing I want to talk about, something totally different, is a Mongolian spot. And I don't know if anyone has heard of it, or maybe their child has it. Feel free to share, because this is it almost looks like a bruise, for a better way of describing it. And unless you know what it is, it can be quite frightening to suddenly see this big bluey purple spot on your child. Classically, it happens on the lower back, over the sacrum area, buttocks area. It can also happen on other areas. I've also seen quite a few on shoulders and back, anywhere on the back. And it's simply a increase in the melanocytes of that area. Melanocytes are the cells in your skin that cause coloration of your skin. It is totally, totally benign. In other words, it does not cause your child any harm, any discomfort, or anything. And the majority of them will actually fade by the time they hit school, is what I normally say. They can persist, however, especially the ones, on the shoulder. I think that those are the ones that seem to stay around for longer. But if in doubt, your doctor can refer you to a dermatologist, and you can talk about laser therapy for cosmetic reasons only. But it is not something that is done on a routine basis, and certainly not until they're older. So the important thing to know is, if there's something that looks like a bruise on your child, If you've got any concerns about child protection, obviously that takes the front, that's the front seat, and you need to sort of address that first. But if you know that this is, your newborn baby, and what is this bruise doing on them, chances are it's a Mongolian spot. And your doctor should be able to diagnose that quite easily. And the other way is, if you can't see a doctor straight away, take a photograph of it and you'll see it does not change. Typically, a bruise will change in color within days. This will not change. So, and as I said, it will fade on its own by school.
Okay, excellent.
The last thing I'm going to talk about today is neonatal and infantile acne. Worries a lot of families, and the whole question is, well, is it acne? Why did they get it? And what can I do about it? There are two distinct things, infantile and neonatal. So I think that's the first thing that I want to point out to you. So neonatal is literally, within the first 4 to 6 weeks of life.
Right.
Strictly speaking, a neonate is within the first 4 weeks, but this is within the first, around about that 4 weeks is when it starts actually for neonatal acne. And what you will see are pustules, so like literally big pimples, and which makes it very hard. I think it's sometimes quite difficult to distinguish from what was I talking about? From the toxic erythema of the newborn. It can be a little bit tricky to tell the difference between the two, but this seems to be more angry looking, whether it's bigger lesions or just a bit redder, and I guess just more localized to the face as well.
Does it bother them?
Sorry?
Does it bother them? Is it painful or irritating?
No, and it also is totally benign and goes away on its own. Sometimes if it's quite bad, we'll suggest antifungal cream, ironically, but it seems to help. And it's not something that'll scar either. So no, it doesn't bother them.
And just to make it clear that don't go putting antifungal creams on your newborn. Make sure that it's only something that a pediatrician or their doctor would prescribe. So don't 100%. Just go buy anything over the counter. This must be something that would only be prescribed by a doctor.
Absolutely. And there's possibly also a genetic component to it. So it's worthwhile asking grannies and grandpas, if anyone had it when they were little, because chances are someone did. And then okay, well, it all went away and you can be reassured. It does not seem to be linked to anything hormonal, but again, we're not totally certain.
Yep. Okay.
The difference between infantile acne, so infantile acne is from around about 6 weeks to a year when it starts. And for infantile acne, they don't only have those pimples, those pustules, they also have whiteheads and blackheads. So like typical picture of acne. Yeah.
Wow.
Yeah, I know, but nothing that you should be squeezing, as tempting as it may seem. And it's also a case of just letting it roll and just letting it run its own course, unless it's quite unsightly, in which case we can try some topical therapy. Again, it shouldn't bother your child, and it doesn't scar, unlike older acne. So I think I've kind of gone through all these harmless rashes, and I just wanted to highlight that newborns, we can stop screen sharing if I'm able to.
Oh, no problem. There we go.
Thank you. I think it's important to know what's normal so that we know when to act promptly and when we can hold off for a little bit in terms of seeking care for our child. Because newborns are born with a whole lot of potential rashes, as well as birthmarks that I haven't chatted about. And then another topic we could also talk about it as I'm chatting now is caring for newborn skin, which I think is a very important thing to tackle.
No, very much so. We could probably do a whole new Facebook Live on that one as well, I'm sure, on the caring for newborn skin. I'm wondering if anybody has any questions as well while we're at it. Remembering that we can't answer specific, questions about a condition that your child has, but we can definitely answer some general questions. So please, now is the time to ask Deb any questions that you have about newborn skin, about any of the topics that we have been talking about at all. Just post them in the comments below now while we're live. So Deb, is there anything else that you would like to, touch on or direct people to as a resource or anything like that at the moment?
No, other than that newborn guide that I have as a resource, that also talks about things like crying and weight gain and nappies and, the general 101 of a newborn. No, I think we've covered all the main common, I guess I would say, the common skin conditions of newborns, but I'm happy to chat about anything else if anyone wants me to.
Yep. Just looking at the questions now. Look, here we go. We've got a question from Cassie, and Cassie has said, do we have any information on strawberry hemangiomas?
I didn't mention it. Yes, another very common birthmark. And if you remember, I spoke about the stork bites and angel kisses. They are flat. So a strawberry nevus or strawberry hemangioma is typically has a bump on it, so it's raised and you can feel it. It's one of those conditions that is also benign, and I'll go into the caveat to that comment in a second. And typically what we see with them is that they actually grow in size until they're around about 18 months old, and then they slowly regress. Usually no treatment is required unless they are very large, or they're in a sensitive area. And by a sensitive area, I mean near the eyes, near the nose or mouth, and near the genitals. The reason being that the growth of that can interfere with those organs. So just the practicalities of having a growth there. The other thing to mention is that if your child has multiple hemangiomas, often it'll be recommended that they have further investigations to make sure that there are no other vascular problems. And I probably should have said, a hemangioma is another abnormality with the vessels. So I kind of skipped over that very sensible comment in the beginning. And so what we sometimes need to do is, for example, do an ultrasound, to make sure that there's nothing going on. And typically we'd see something in the liver. But that is only in a select few children. That is not in your typical child who's born with one, maybe two small hemangiomas that, as I said, will grow and then regress on their own without any issue. If they need treatment, it's often medical. In other words, medication. And very occasionally they'll need any other kind of intervention. So I hope that helps.
Right. Excellent. And also if, for example, a child's got a hemangioma, say on their head or something like that, do you have to be a little bit more careful about them bumping their head, or are they more likely to bleed a bit more if they do that at all?
I find, Sarah, it all depends. It depends on the size, exactly where it is. If it's over a bony prominence, so yes, on the scalp, because there's not much cushioning, then yes, there is an increased risk of, it's just a little bit more friable, I guess, a little bit more sensitive, that skin. It doesn't mean that they're going to spontaneously bleed from it. I guess that's the point I want to make. But it is more, it just doesn't have all those coverings, It doesn't have the fat layer and, all those extra skin layers that other skin would have.
Okay, and I guess that leads into Cassie's next question as well, is should you be careful about cleaning around them? So is it just the normal, just face washer over the top? And
I would just do normal. It's not painful for them. It's just a case of, but you wouldn't want to be scrubbing your child's skin anyway. So it's exactly as you would care for their skin.
Yep. Okay, excellent. All right, very good. Thank you for your questions, Cassie. Yep. So it doesn't look like we have any other questions at the moment. So we might wrap up our skin talk today, and we will be coming back same time next week. So that is at 10 a.m. Sydney time next Wednesday. And we will be talking about another newborn topic, won't we? And I can't off the top of my head actually remember what one it is.
I've got so many things that are in the air at the moment. I just want to say, anyone who's on Instagram now, let me know if this worked for us to do both at the same time. We're kind of experimenting with it, trying to spread as much information as we can. If it doesn't work, we'll abandon it or do something else on a separate time. I do my weekly lives on Instagram anyway, but that's without the wonderful Sarah, and I thought it would be lovely to have her on. And both Sarah and I are very happy to accept any suggestions. Just DM us and we will do our best to cover them in one of our sessions.
Absolutely. Well, we'd be delighted actually if you could do that. So please do. Okay. We love hearing from you, because remember, we're doing this to bring to you. This is what we want to do this for you. Okay. Otherwise I'd be, I wouldn't be trying to tackle all these tech issues that I keep having, which I'm going to go and tackle now.
And then my lights went out, so it all just happened today. But anyway, thank you everyone for bearing with us and all our technical foibles today. And hopefully you found this useful.
Okay, bye everyone.
Bye everyone.